waves of fatigue, the inability to smell milk that has gone bad, a racing heartbeat. These are just a few COVID-19 symptoms that can linger after an initial coronavirus infection. Though they may not always amount to the debilitating cases of long COVID-19 that can leave people bedridden or unable to perform daily functions, it's very common to take weeks to fully recover, a condition I've been thinking of as medium COVID. I've been reporting on COVID-19 since the coronavirus. I knew there was a risk for long COVID-19, even with mild cases, but in my mind, there were two types of COVID-19, run-of-the-mill cases that didn't last much longer than their isolation periods required, and long COVID-19, which was relatively rare. Instead, like so many Americans, I found myself caught somewhere in between. With record numbers of Americans contracting the coronavirus during the recent Omicron surge, many have discovered that recovery has not always happened as quickly as they've been led to expect. But does that mean they have long COVID-19? There could be more to help people understand that it's not always a quick bounce back right away after the initial infection, said Dr. Ben Abramoff, director of the Post-COVID Assessment and Recovery Clinic at Penn Medicine in Philadelphia. This is still a very significant viral infection, and sometimes it's just a more gradual recovery process than people's previous viral illnesses. COVID-19 symptoms that last for weeks may come as a surprise to some, especially after recent messaging from health authorities. In December, the Centers for Disease Control and Prevention announced that those who test positive for the coronavirus can exit isolation after just 5 days if they are free of symptoms and continue to wear masks. That recommendation is understandably focused on the period during which someone is contagious, and as a result, it doesn't mention anything about lasting or recurring symptoms that might continue after the person is no longer infectious. But it can have the effect of suggesting that, for most people, the recovery process is, if not 5 days, pretty quick. That's the message it sent to me, at least. Like so many Americans, I got COVID-19 over Christmas. I was vaccinated and boosted, and my case was indeed mild: sore throat, sinus pressure and headache, extreme fatigue. After 8 days, I was feeling better, and I tested negative 2 days in a row using rapid antigen tests. I was anxious to get back out into the world. Most people I knew were still lying low to avoid an Omicron infection, but I was armed with a bit of extra immunity, making me feel low risk. Party time. Not quite. Soon after ending my isolation, I had dinner at a friend's house. One glass of wine left me feeling the next day like it had a whole bottle. I was bone-achingly exhausted but couldn't sleep that night.